So hi friends, dentistry is blooming. Yes, it is. We are all gifting beautiful smiles to our dear patients, and our dental photography is a testimony for this. With the advancement in digital world, we must have seen so many dentists taking before and after pictures and sharing their cases. And this is possible because of dental photography. In this session, let us know about why dental photography is vital in dentistry, how to take a good picture, a dental picture, what are the important basic things that are required to take a good picture, how to convince a reluctant patient for before and after picture, and whether if any consent is required or not. We will also talk about editing, gadgets required, and many tips on how to take a good dental photograph. Also, towards the end, we had fun yet insightful rapid fire round with our guest speaker. So, now let us talk about guest speaker. Our speaker for this session of Success Talks is a dentist who is passionate about photography and is a certified photographer. Trained in advanced photography from Moscow, Russia, she has won the title of Best Female Photographer of India. So guys, let us welcome Dr. Ritu Gupta. So, my dear audience, today we have Dr. Ritu Gupta, a famous photographer, and let's dive in without further ado. So, Dr. Ritu, our first question is, what is dental photography and why photography is so vital in dentistry?
Okay, this question is, the answer is going to be a little longer, but I'll try to finish it in a lesser time. So, dental photography, if you would ask me, I would say it's a tool to practice in your dental clinic, which has many uses like communication with the patient, communication with the consultant, communication with the lab, and then you can also use it for your marketing. And there are many reasons like this only, and this is something which now people are adding in their practice. So, if you are doing dental photography, then these are the things. And if not any, if not these reasons, then two reasons which I prefer and which I insist telling, that one is that medico-legal aspect, because that is something quite pure thing to show. If somebody is coming behind you and suing you for something, and you will be having something with you as a proof or as a support. And other thing is, even if not, if that is also not the reason you want to do it, then it's a self-assessment. At least you will be knowing that what you are doing today, what you are doing after 10 days, what you're doing after years. So assessing yourself through a photograph is a bliss. You get to know कितना काम किया है, कहाँ पे कम किया है, कहाँ ज़्यादा किया है. When you have achieved perfection, when you require more work to do, you need to learn more, all these things. If you are honest to yourself, that's the best way to get to know that where you are exactly. Yes.
Okay. So like I've seen and I've gone through many people I've had interacted with a number of my friends, and I see people doing good job, but they do not document. That is, they fail to document. So why do people do not take pictures, and what makes them not to take pictures? As per you, what all the reasons you have come across?
So that is a question which so many people so many people ask me. I get it quite often. I believe there are two things which are responsible for not practicing dental photography in your setup. Number one is comfort. So, of course, we are dentists. So that is our priority, that we have to work on a patient. Documentation is no doubt is important, but secondary thing, right? It is not giving a treatment. So people don't want to, and it's not only dentist, it is the general concept that people don't want to leave their comfort space, right? Their comfort zone. But yes, of course, if you have to do something different from others, you have to move from it, and then you should do it. You have to do it. If you there's like it's a race now. So if you want to make your practice out of the crowd, you have to move out from your comfort zone and do different things. So that's one reason from me. And other is priority. As I said, that photography would be a secondary thing, and dentistry would be a primary. So that's a priority. Like why people are doing a patient. So if your purpose is just to, do the patient, get money out. I mean, I might be using different. Not acceptable words for this, but we work for money, right? So such people will be just doing it. That patients are rahe and you keep doing it, and that's it. They just don't want the pictures. Now, number two is the crowd where they want to market, that they want a good footfall. They have just started. So they should do it, because then they can show it to many, like if they can use it in many places. So it may be a priority for them. And of course, because they have just started, they might not have patience as much as the experienced dentist would have. So that's the thing. I think the priority and the comfort level of doctors, they think about it and accordingly they do it. So now your purpose, it depends on your purpose. But anyways, if you'll ask me, I'll always have a reason to do it. Even if I'm practicing for money, or I'm practicing for, I'm a new practitioner or anything like that, I will always have a reason. So yeah, I think that's the reason.
Okay. And I would want to know your perspective on before and after pictures. Like, as you said, people, they document for various reasons. We should document for various things, keeping either it be a marketing or medical legal thing or whatever. So what is your perspective before and after pictures?
Okay, so that's very interesting question. First of all, I have been learning through my pictures. That, as I said, that self-assessment is very important, and that is what you get from dental photography if you're not using it for anything else. So I have been learning from it from the very moment when I started, because of course at that time I didn't have other reasons except because I was learning dental photography. I was almost at the urge of learning dentistry more and more, and then doing composite, doing aesthetic cases, where I really needed to have such kind of skills. So I think I would craft it in a way that having a picture before and after is a kind of a magical moment for me, because nobody can see the way your picture will show you that what have you done. The patient also cannot see what you have done. How have you done? So this changes, that's why I call it a magical moment or a magical event, because we are doing aesthetic case, maybe a simple composite aesthetic case. So the changes which you get in a patient's face, or the changes you get pre and post, that is totally magical. So this is how I take it, after and before picture. You actually get to see what have you done, and then you appreciate yourself, or maybe think that okay, it's not good enough, and so on.
Okay. So I have my fourth question. So now once a dentist becomes comfortable,
so
once a dentist
I'll add one thing. I'm so sorry to interrupt. So
yes, no, absolutely.
The way you do general photography, we say that every picture has a story, So for this also, if you are taking a pre and post, both the picture have a story. Now, if you will be taking an extraoral picture of that patient, or maybe emotional dentistry related pictures, so that changes, it changes entirely. So for me, every picture tells a story. What was before, what happened after that. So emotional and physical, both the aspects are there if you talk about pre and post pictures. Yeah, thank you.
Okay. So now once we are pretty convinced
I'm sure viewers will be pretty convinced after these three answers. So now it comes to patients. Many a times, while we take before pictures, we've seen that patients, they become a bit paranoid, a bit uncomfortable. Many of our patients, they hesitate. So what is your view? What are your tips? And what are your comments on that? I mean, should it be taken, and how to prime a patient, like how to make your patients comfortable? uh, we all know patients are comfortable after the change, but before the change they are not pretty comfortable. So how do you take this?
This is very common that patient feel little awkward in getting it done. Some patients who are very smart, they might ask you questions that why do you want it? नहीं करेंगे तो चलेगा, or they will have their own kind of queries. But I think what I do, I tell you what I do. So I be very nice to my patient so that they don't say no to me. And the trick which works is showing them your previous cases. That, see, this is the picture when before the treatment, and now you can see. And don't, you might skip showing the intraoral pictures, right? Because intraoral to aap lo bhi loge to you can cover the eyes and you can use it, but of course not without the consent. But you can tell the patient कि भाई आपका face नहीं दिखेगा, it will be just your oral cavity. But if you want to take extraoral picture and want to use it somewhere, even if you're in your clinic or in academics or somewhere, you show them a previous picture, nice pictures, not any which has a big change. That kind of pictures, you show them, and then you see, we need it for our record. Number two, you make it mandatory. कि नहीं भाई, वो तो करना पड़ेगा. That is our record. That is must. That we have to do. But that you can promise them, or you can assure that we are not using it in any social network or like that. But utna to karna padega. So you can make it mandatory in your clinic. And number three is that, yes, when you show it to them, it happens. I think 100% of my cases, I was able to convince with the previous cases. They were ready. Okay, madam, you can take it. So that's the thing. And it works. I think it will work for others also. Yeah.
Okay. So I really like the idea that you said, na, we'll have to be nice to our patients. So any which ways, photography is giving you one more reason to be a nice dentist.
Exactly.
So how about taking consent? How important is taking consent? Is there any format which you recommend, or what do you say? Because many a times now what we see is almost every second dentist is posting it on social media. And now I'm not pretty sure about the consent part. So how do you take this? And what is your suggestion?
So for me, it's like just keep it simple. You get consent signed for every case, right? We get it for every case. Just add one line that you will be photographed, and we might use it for various reasons, for academics, for lab work, for just make a comma and write it down. Ask the patient to read it. Just include it in your general consent form. So there is no as such a big other format or any other form for this thing. There might be available maybe somewhere. People might use it, maybe not in India, but other places. But I think for us, make it simple. I mean, it has to be a simple thing. It's one-liner, because usually patient don't read it. They just sign it. But a smart patient do, and they ask also, and then you can tell them that ye karan hai, isliye we are taking it. That's it. Make it simple.
So one of my friend, although this may sound silly, but he says कि हमारे लिए हर एक patient celebrity होते हैं, star. So we take pictures.
Yeah, that's a good way, actually. Yes, you can tell the patient, to praise him that you are very important to us. So yeah, and when you are into photography, you have lights and camera and a little show off things. So not show off, I would say, but for the patient, it's a huge thing.
Yes.
So they might get, there are two things. They might get nervous or they might feel awkward. कि भाई, we are not photogenic, कैसे photo खिंचाएंगे, like, or they might get excited. Wow, we will be getting clicked like this. So that's another way to, to attract them for a picture.
Perfectly fine. Very nice. So now we would want your nuggets, your tips on photography at dental clinic.
So once you started dental photography in your clinic, I think the most important part is having thinking about sterilization, how you take your camera, and I cover it with those polythene bags, autoclaved, or sometimes gloves. So all these things are there which you should take in your mind, take into consideration. Number second tip, I would say that train your assistant, because at the beginning you might not be able to do it regularly. So start training your assistant, whoever is standing next to you. At least give him a basic idea or basic angulation. Tell him that you have to do it like that. So that's the second thing. Number three, if you are really into it, have a small space or corner for lights, for external pictures. And number four, and the most important, I would say, is the light. Like having a perfect, nice light for your pictures, external light. I'm not talking about ambient light or sunlight or anything. So I think these things are important. And if you use it in your practice, the dental photography can be easier for you.
Perfect. So as we all know, nowadays mobile photography is flourishing. So is it
Yes.
okay, or is it a good idea to use mobile photography as a part of routine dental photography at clinic, or DSLR or pictures with DSLR are must? What is your opinion?
See, being a DSLR user, and I'm doing it for very long now. Honestly, I don't use mobile for photography. Now, technically, if you will talk, there are many reasons which you cannot get, which things which you cannot get in a mobile photography, but you can get it in DSLR. Now, there are many doctors who are doing mobile dental photography, but few things I would, it's just all my opinion. I'm not generalizing it. I'm not giving any rule or standardization about it. It's their choice and they use it, and I really respect it. But there are few things like you cannot get enough light in mobile photography because you are not using any external light. Even if you are, the light which you get in a DSLR with the external light source, you will not get into mobile. Number two, distortion. If you are presenting that work in certain publication, you need to have minimal or least distortion in your pictures. Mobile cannot give you without distortion. It will always have some distortion. Yeah. So in your dental practice, of course, it's not mobile dental photography is not prohibited or something. Of course, people are using it. So you can also use it even if you have a DSLR. So if you have a messy case, where you have to do it again and again, it is little uncomfortable for you to click the pictures, you can use your phone. So, and one thing which I was saying, yes, that a few publication will not accept mobile pictures. Medical legal aspect will not accept mobile pictures. So all these things. But yes, to start with, to practice and to incorporate photography in your practice, it's always a wise idea to use mobile.
Perfect. So if you could now tell us what are the basic things required. I mean, they think we need DSLR, flash, etc. So what are basic things which a dentist should have in his or her clinic to start photography with DSLR?
Okay. So a camera or a DSLR is least important thing. Whatever camera you would buy an entry level camera, economical range. You can buy a high-end camera. It actually does not matter what camera you have. The most important thing is the light and then the lens. The light, because all those pictures you will get with a proper external light. So for that, what I use is a twin flash, where you have two flashes symmetrically, which you can, change. And other thing is lens. So for dental photography, we use a macro lens, which is 100 mm lens. Canon makes it 100 mm, Nikon makes it 105 mm. So these are the two lenses which claim to have least distortion and the best for dental photography. So the best part about these lenses that you have a decent distance from the patient. You're not too close, you're not getting into the patient's mouth only, or even if you're far away or taking extra oral, you have enough distance so that you can click and you can see what you're clicking. Usually other lenses which claim to do dental photography, which are not 100 or 105 mm, for that you have to go far away from the patient and have the same picture. And then so far that you cannot even see what we have done, which tooth you have worked, how will you click? So that's the thing. So 100 mm and 105 mm are best lenses that you have to have for dental photography, twin flash, and then a DSLR, any DSLR camera.
Great. So how about, I mean, yes, once we understand that these are the basic things and we've taken a picture, now how do you see the role of editing? Should it be done or not? And why? If editing is recommended, why is it important?
Okay, so usually when you are doing a dental photography with 100 mm lens, you should not require editing because the light is sufficient. You have different magnification ratio in your lens so that if you are clicking, if you are working on interior 6 teeth, that will be there in your frame. You don't need to crop it or zoom it. So for these reasons, for cropping or for light, or if it is underexposed, if it is overexposed, all these things you can correct at that time only when you're clicking a snapshot, like when you're clicking the picture. So for that reason, you will not need to have editing thing. But yes, now what happens that when you click any picture, anybody, not only the dentist, you get some kind of color casting in your images, like because of the light, because of the ambient light, sometimes because of the angle, sometimes because of some settings, you get some color in your picture. So to remove that color, you might get a post-processing step after clicking the picture. That is one reason. And the other is when you are using selecting a shade for your restoration, and then you have to send it to the lab. So for that, we use gray card. That gray card is used, and then you have to click a picture with the shade and removing the color cast also, and then the shade again, and removing the color cast, and then sharing it with the lab. So for those things you need editing, but for the basic editing like the cropping or the lights, that you should be perfect in your first shot and in your snapshot. You should not do it. But for technical requirement, you should do editing. You need editing, I would say. Yeah.
Any specific application which you recommend?
Yes.
Or which you use?
So people are using Canon and Nikon both in dental practice. So there's a standard app which is called Adobe Creative Cloud and Adobe Lightroom. It's not very expensive. For a basic package, it is around 750 rupees per month. You get a subscription and you get the most updated version of that app. And it's good, easy to use, user friendly, and thoda sa lagta hai time to get into it. But if somebody is there to tell you how to use it, it will be easier. So yes, that's the app, and that's the app I use, and I think most of dental photographers use.
Okay. So I'm pretty sure like lot many viewers are pretty new to dental photography and they might not be in detail aware about lenses. So if I were to ask you on a layman's term, what are lens exactly? Like whenever a, a dentist who's not very well versed with dental photography or DSLR cameras, what they do is they just go and buy a DSLR cameras. Uh, so what are lenses and what are the things to keep in mind while buying a DSLR? Specifically
Okay,
keeping lens into consideration.
all right. So if you want me to talk about lenses in general, so there are categories of lens. We call a 50. It is the lens is nothing but it has a focal length, right? So when we say I'm saying 100 mm, that means 100 mm is a focal length. I'm saying 50 mm, that means 50 mm. So 50 mm we call as normal lens or a prime lens, prime focal length. If it is going less than 50 mm, it goes towards the wide angle lenses. Wide angle, like you will be capturing a wide portion in front of you. And if you will be moving forward, like if you'll be going more than 50, it will go towards telephoto lenses. That means you're standing here and you can click far away picture with closer. Like it will be bigger, though far, but bigger in your frame. These are types of lenses which we usually talk about in general. And so hence the 100 mm macro lens, which we use in dental photography. So it is a macro lens where you are seeing the macro means that you are seeing the picture in your frame and the reality picture has to be into 1:1 ratio or lesser. यानी कि छोटी चीज जो है आपको उतनी ही बड़ी आपके फ्रेम में दिख रही है. So that's a macro lens. That is what we need in our dental practice. I don't know if I answered your question well, or if you want to ask anything else, you can just shoot. Okay.
So my next question says, it's a very basic one. How did you get a good dental photograph or a good photograph?
So you're talking about me? Okay. So see, when I started photography, it was always, I loved it. So I did it so much. Like the camera was always next to me. So what I think is to practice. I practiced it so much and explored. I started with macro photography, like macro dental photography, but I didn't stop there. I bought many other lenses and I started using those lenses. I started exploring those things. Even with one lens, I started exploring different aspects of photography, or different other genres of photography. So I think it's just practice and zeal to explore more, just explore the unexplored types. So that's the reason. I wouldn't say, I would not say that I get good pictures or it's I cannot say that. Yeah, of course, I love my own pictures, but I think that's the reason for me to get that thing, because earlier I was very naive. I just didn't know how to do it, and that thing came with practice and exploration. That's that thing. Yeah, that's it.
So takeaways, having a good practice.
Yes, I
So
think that
as
is
we
important in
said,
all kind of things.
yes. So as we see that photography is a passion, you need a third eye. We say ना दुनिया वही है, but photographers यही दुनिया कुछ खास नजरिए से दिखाते हैं. So can you summarize this? या आपका view क्या है over this?
This is actually a very apt or appropriate thing about photographers. I would say a camera, a lens, or a technique or setting. All these things are secondary. The creativity is in your eyes. Every photographer has a different level of creativity. Not level, style of creativity. if I would love to click a picture from a different angle, maybe the other would love to click it in a different angle. He would like that, I would like mine, and we both will like each other's. So yes, we get a third eye, or photographers get a third eye, because the whole perspective changes. You're not sitting like this and clicking a picture like that. You are thinking about how to click that picture. You're giving your thoughts on that one picture. You are thinking from where you are getting the light, from where the subject is seeing, or how he is standing. हवा कैसे चल रही है? I mean, all those things. So, it's kind of a lot of effort picture. That one picture is with efforts, of course, which you may be a little faster, and later on, when you are quite well with all these procedures. But still, if you are at some place, you will be taking time in making that frame. So I would say that it's an effortful picture, so that changes, and that actually makes you mad. I mean, not mad, but crazy for doing that particular thing. That's why you call it a passion. So yeah, that's it.
Great. So let's move on a bit lighter note. We have some one-liners. You will have to answer those things, or you'll have to choose any of the followings.
Okay.
So what is that one thing you love the most about photography?
So photography, I would say that a different perspective, which I just spoke, like the people see it in different eyes, with different eyes, and we see it in a different eye. So that's something which makes it, apart from a general things. Yeah.
Okay.
Perspective
what
to
is that?
watch, perspective to see.
Amazing. What is that one thing you love the most about dentistry?
I think patient satisfaction post-treatment. I work for
Good.
that only. Yeah.
Great. So what is that one quote that keeps you high and motivated always?
Life is short. Do whatever you want to do in time. And don't die regretting that you didn't do that.
Yeah, somewhere I've heard there is you feel that guilt, the regret of not trying is more than the regret of failure. So
Right.
it goes very well. Okay, what is the
Exactly.
biggest lesson of life?
I would say there is no shortcut to success. You have to work hard for it. Then only you'll get it. That's a lesson.
Great. If I were to ask you to choose any one among dentistry or photography, which one would you choose and why?
So I will always choose dentistry, because my dentistry includes photography.
Oh,
So
wow.
I'm not going to leave it. And the time and the patience and the hard work and my golden years, which I have invested in dentistry, I really, if I were to choose, if I would choose photography, I think it won't do justice to all those, time and whatever I have invested in dentistry. So yes, it is going to be dentistry always.
What a beautiful answer. I must really confess. Okay. So tell me, share your ultimate goal in life. What is your ultimate goal in life?
I want to get retired as soon as possible and see the world. And I have few list of places where I can go and do some social volunteering,
Wow.
teach people, give your service for free, and those are good places, So I have to visit those places too. And with that, I want to do all these things. So yeah, that's it. And then just chill and roam
Okay.
around.
And we know that you literally die and you have a very good, very good and very beautiful daughter. So if you were to choose between a full mouth rehab case or time with your daughter, I know we know the answer, we can suspect, but still we would want to know and why.
Okay, so I don't know what answer but it's always going to spend time with my daughter. The reason is that she's growing. Every day is different. It's not same. We have grown up. Like even if we are, passing time, but there is a monotonous thing. But she's growing. Every day is different. Every day she's one day older, and I just don't want to miss that thing because it is not coming back. You know, if she is losing her tooth today, it won't come back ever again. So yes, I try my best to spend as much as time to spend with my daughter. Dentistry is always secondary for me. यहाँ पे dentistry पीछे है. It's always my daughter.
So yes, definitely I was expecting and suspecting this answer because even I have a daughter and I think we are on same page. This question was from the perspective of work-life balance basically. So because I see lot many friends, lot many dentists, they lose this aspect of beautiful thing known as life. So I intentionally kept this answer question and you answered it very beautifully.
Right now I mean we are at a stage where you are not willing to miss those things, but once they will start studying, they will go out somewhere, then you will realize that why we were not there at that time when you could. So it's just like I don't want to regret that thing. That's it, and I don't want to miss it. I don't want to be that kind of a parent who are more into work, dedicated, but into work and not bothering about what's happening back at home. So yeah, that's pretty important. I have only one daughter.
Amazing. Oh, wow. Amazing. So I must really confess that the whole conversation was very delightful, very blissful conversation, and our viewers will have a lot to take out of this conversation. I know this chat, this conversation will give my viewers a very different and a very beautiful perspective of dentistry and photography as well. I would ask you one more. You say your message on our mission of Wise Dentist, which is to help dentists across the world, I would say, not only in India, through our success talk. So, what is your message?
uh, Number one and most important, which I could not do at some point of my life, regretted later, but then never didn't give this chance to regret any further. So that's take risks. That is really important, because if you have that gut to take that risk, you can do anything. But if you're afraid of taking any that kind of risk, you're a loser. I mean, I'm sorry to be so blunt, but I took time, but then I realized that जब तक आप इस तरह के risk नहीं लोगे, you cannot do better. That's simple as that. Number two, I think most of people say, but that's the fact that failure, never lose hope if you fail, because if you keep trying, your hard work will never go wasted. So if you are failed today, you failed today, definitely you will get something out of it, and always learn. Never repeat your mistake. I mean, that's a wise thing to do. That people should not repeat their mistake and rather learn from it. So yeah, and the last thing I think I would say that just don't wait for any appointment. Sit back at home and waiting that ek din aisa hoga. No, don't do that. Just start working on whatever you want to do, and don't wait for any opportunity or any chance that you think that something will knock your door. That doesn't happen anymore. So just find the opportunities and start working on that. And that's it, I think.
Thank you so much.
Wise enough.
Thank you so much, Dr. Ritu. And I'm pretty sure that, as I said earlier, that my viewers will have a lot to take out of this conversation. The conversation, as I said, was really blissful. We look forward to hosting you again and maybe on some other platform. Thank you so much on behalf of whole team of Wise Dentist and all the viewers.
Thank you so much, Dr. Ravi, for inviting me and giving me this opportunity to talk about it, because I really want people to understand the basics. Why do we need it? And if I can, if I could convince a single person after this conversation, I think my job would be done. Thank you so much for this.
Great.